Cleveland Clinic's cardiac rehab alongside Dr. Mark, where you guys have been pretty darn busy here at the hospital.
We sure have. Last year, more than 4,000 open heart operations. That's on the 4th floor of this building, but it needs to continue getting better down here at the Cardiac Rehab Center.
So you've seen countless amounts of heart surgeries. You know that's basically a phase 1, and I guess you would call this phase 2 in a way?
Yeah, the heart surgery takes 3, 4, maybe 5 hours, but that's just a new beginning. The new beginning's got to be followed by people taking care of themselves, and that's where the cardiac rehab staff steps in to help you.
Blood pressure's doing today.
So what all goes on down here, and how do doctors then help them once they leave here?
You see a lot of exercise equipment. That's a big part of it, but it is nutritional counseling, making sure you're on the right medicines, getting the right exercise program, making sure you don't overdo it, but at the same time, we want you to push a little bit so that you get in shape, lose weight, have your diabetes melt away, your blood pressure fall. That doesn't all happen at once. This is a 36-step program, 3 times a week, 12 weeks, starting a couple months after surgery.
126/72?
Yes.
And this gives you habits for life, for ideally a long life free of heart disease. But Natalie, this is Paul. Paul is a cardiac success story. He had bypass surgery. When was that?
Middle of August.
Middle of August.
14.
And how long were you in the hospital?
10 days.
Which is a standard, sort of what we call a length of stay. And now you're back. We're at the Cleveland Clinic Rehab Center. You're in the hospital. But tell me about how your life is different. You're exercising.
Oh, I'm exercising much more than I did before, yes. I'm walking about 3 miles a day on the treadmill every time I come to the rehab session here.
Before your surgery, you had diabetes that was pretty severe. How is it now?
It's much better. The numbers have dropped greatly. I'm on less insulin, less frequently.
Do you feel better?
Absolutely, 100% better.
Now, we heart surgeons would love to take credit for that, but the truth is, it's you, it's what you're doing right here and right now that made you feel better.
So what do our viewers do to stay out of your operating room?
At the risk of putting myself out of business,
Yes.
The advice is simple. All these exercise machines, exercise, walk, you don't even really need the machines. Just walking every day is the single biggest secret to avoiding heart disease and keeping yourself out of my operating room.
Thanks, Dr. Mark.
My pleasure. For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.